Hello, people who speak English in our school. This is the radio television in English language. Today, another topic regarding posture. As you know, NPR, Myofunctional Postural Rehabilitation, and NPR International School deal ever with the neuromuscular skeletal diseases. That's why we're talking about topics regarding the function and dysfunction of the posture. Today we will talk about craniofacial system and muscle change. Don't miss this transmission. It will be very interesting and very important, and very, very important for everybody, every medical science, and also for patients. Craniofacial system, very big disturber of our posture. In posturology we study very well the dysfunction of the craniofacial system. And I think it's very important for everybody to understand how this dysfunction can affect the rest of the body. And this is the topic of today's presentation. The today's presentation is dealing with this. How the masticatory system, or better say, the craniofacial system, can affect the muscle change of our body. But before talking about that, we will do our opinion regarding muscle change. Always we talk about muscle change. The definition of muscle change is different muscle connecting each other that have a synchronization in our body. But for us, muscle change is a different thing. We also divide in lateral muscles and posterior muscles that more affect the posture. But we said that there is not a muscle chain exactly. It's a domino reaction in our body following different muscles. When some part of our body is dysfunctional, it starts in the rest of the body a domino effect with different muscles affected. We said in our school it can be lateral muscles, it can be posterior muscles, and it can be cross reaction, the most difficult and dangerous. And I try to explain today how from the top, because this muscle reaction can be from the top or from the bottom. The muscle reaction from the top can affect the whole body, and that's happened when the craniofacial system it is dysfunctional. Pay attention in the presentation. The craniofacial system always, its dysfunction will affect maximum or minimum the rest of the body. Please pay attention on it. When we have a dysfunction in the craniofacial system, very complex system, it will affect the rest of the body, affect the muscle, that then with this domino effect will lose the balance. This system affects, or mainly, it is in dysfunction when the mandible or the lower jaw is losing its centrated position, its balanced position. Lateral changes of this situation, that means lateral deviation, generally alter the lateral muscle change. And the forward or retro position of the jaw mainly affect the posterior change. Imagine how a changing from the position of the jaw can affect lateral on one side or both sides, or cross affected, and also can affect the posterior muscles in our body. That's very important. Jaw position starts a domino effect, and I will try to show you how. The key is the hyoides system. Hyoides system is the connection between the craniofacial system and the rest of the body. There. Hyoides system, as you know, is formed of different muscles, upper hyoides and lower hyoides, connecting with the jaw, with the cranium, with the clavicula, with the neck. Anytime we have a craniofacial dysfunction, this system will have hypo or hyperactivity into the muscle change dysfunction. The main symptom is, if you see clinically, when the jaw position loses the central position and the craniofacial system is dysfunctional, the main symptom is the biclavicular line. This line is affected when the jaw is changing the position. When we lose the central relationship, the central nervous system starts the bruxisms. That bruxisms is creating hyperactivity in the muscle chain, and also is creating a block into the craniosacral breathing, creating also dental abrasion, making worse the situation, start TMJs diseases and neuromusculoskeletal diseases in the future. Bruxisms increase pressure in the craniofacial sutures, creating a lock of these sutures, a functional lock, who is creating also functional asymmetries. The back position is the worst situation. This causes changes in the position of the head, and if it's chronically, it will block the first and second cervical vertebrae. In that situation, it's compressing the vertebral artery, generating less irrigation in its areas, and also chronic pain, and generates hyperactivity of cranial muscles, such as the temporal, frontal, and occipital, causing blockage of the cranial sutures and primary sacral cranial breathing. Lower position affecting a lot of muscles in the cranium, and slowly that situation is going down and down. It will affect, if it's chronically, in the posterior area of the neck, and if it's lasts in a chronic form, causes blockage in the cervical area. And we see there a lot of trigger points, mainly in the suboccipital muscles, trapezoid area. Also, that is created by accumulation of lactic acid. This trigger point is a symptom of alarm, not a disease, and should not be turned off before diagnosing where it comes from. chronically is descending in order to generate hyperactivity of the back muscles. Back symptoms of pain in the large dorsal area are due to a mandibular dysfunction. The humeral joint diseases are also due to malfunction of the masticatory system. Anatomy show you that, the connection of these muscles. If we go in chronically, it's creating hyperactivity of the masticatory system. It's generating hyperactivity of all this structure of muscles, muscle chains. For this reason, many symptoms of trigger points are by accumulation of acid in the muscles. These changes chronically is creating adaptation. The main adaptation is the scoliosis adaptation. Scoliosis adaptation is the most common thing in our body. It's not a real scoliosis. As you see there, a patient with the lateral deviation, how the body adapts, overloading the right side. And look at this, scoliosis, creating back the Cranio fascial system dysfunction and a foot support in this case. As you see, it's very important to have an holistic point of view when we deal with this particular pathologies. When we have a good balance in our muscle chain, we will have a good balance in our structure and good postural health. That's why we said the postural health is a good indicator of good health of the body, because it's all connected, all connected in our body. And when we have a dysfunction, this harmony is finished, and then the structure adapt to this new situation. That's why it's very important to speak the same language in diagnosis and therapy. And when we talk about scoliosis, normally in medicine we describe it as a pathology, a very bad pathology. But the scoliosis is a symptom, is an adaptation at a bad function on the tonic postural system, when the receptors lose the harmony and we have an interferences into the muscle chain. Remember, don't forget, body is connected. We cannot deal with only one part of the body. In the NPR, myofunctional postural rehabilitation method, this science is dealing with the whole body. We call that holistic therapy, holistic diagnosis, holistic planning, and holistic treatment. A very interdisciplinary action. And remember, body is connected. We cannot treat only one part of the body. And also, a dysfunction in one part can affect the other part. That's why we need an interdisciplinary treatment in the physical rehabilitation. We have to work together. Medical doctors, dentists, physiotherapists, osteopaths, all together with the same language of diagnosis and treatment. And do not forget that our body is like a universe. And in the universe, all is connected and all is working in the same way. That's why it's very important to speak the same languages working. And NPR is doing that. I hope you enjoyed this video, enjoyed this presentation, and we see you in the next transmission in our NPR television. Thank you so much to be there, to follow us, and remember, follow us in our socials and also in our application. Bye bye everybody, until the next transmission.